Imagine you had a long day, lots of homework, and if you're lucky, only 2 lecturers called you lazy and inadequate. A regular day as a med schooler. Anyways, you pick up a ball and call your friend Jimmy and you all go out to the court to unwind. So y'all are playing and things are going great. Your endorphin levels are off the charts and you have wings like an eagle to fly above all your problems. But then fast comes the realization that you're a med schooler and so your hand-eye leg coordination ain't quite there yet. So you fall on your ass and scrape an elbow and it starts to bleed. Now how does your body react to this so that, you don't bleed out and die? This is through a fine process called hemostasis, which is kind of just a fancy name for the stoppage of blood flow. See? No guys, that this is easily confused with homeostasis, which is the maintenance of constant body conditions. Hemostasis usually happens in a couple of steps. First, vasoconstriction of the affected blood vessel to reduce the amount of blood flowing through it. And then platelets, also called thrombocytes, aggregate and clump together, forming the platelet plug. If the wound is small enough, vasoconstriction and the platelet plug are already enough to stop bleeding, and we've all probably noticed this too. When you have a small cut and it stops bleeding after like a couple of minutes, even before the hard stuff forms. As we can see, platelets, even though they're not nucleated, and so technically they're not real cells, but they're like fragments that break away from the megakaryocyte. But they're actually super important, not just for the obvious process that we're talking about now, but these platelet plugs manage small cuts that develop all over our bodies and blood vessels every single day, and they stop them from becoming major issues. And without them, a person would have a condition known as thrombocytopenia. Obviously, there is a whole story here about these platelets, but maybe I'll make another video on that in the future. So we have our platelet plug at the trauma site, and after this, actual blood clotting happens. So blood clotting usually ends with the formation of a mesh of fibrin fibers, which blocks the hole so it stops bleeding. So now that we know what clotting is and why it's important, let's go a little bit deeper and look at the actual steps that cause it to happen. So there are 2 clotting pathways, the intrinsic and extrinsic, and these pathways involve clotting factors. Blood clotting factors are majorly produced in the liver and they can be secreted by platelets, which are at the trauma site. So there are 12 major clotting factors and they are represented with Roman numerals. Don't get confused guys, because the last clotting factor has Roman numeral 13, but they're actually just 12. This is a list of all the clotting factors and they're going to be involved in the pathways that we're going to go into. But not to worry, these pathways are not hard to understand at all. So the major difference between the intrinsic and extrinsic pathway is what triggers them, aside the actual composition of the pathway, of course. We're going to see these differences in the next video where we'll go into the pathways in detail. So their product is the same, their purpose is the same, to form a blood clot in order to stop bleeding. So it means that up until a point, the pathways are different, but from that point downwards, they're the same. So that point from which they're the same is what we're going to be looking at now. So after we know this, in the next video when we learn about the pathways, we can then combine them with this last step, which is not complex at all. So let's get to it. So this process is going to start with prothrombin or factor 2. And as a rule of thumb, when you see pro before a protein or O gene after it, it automatically implies that it is in its inactive form, which is called the zymogen. And so it will need to be activated before it can, do anything. So we start with prothrombin, and prothrombin, after it attaches to platelet receptors at the trauma site, see, platelets again, then prothrombin gets activated in the presence of calcium by the prothrombin activator to thrombin. So after prothrombin has been activated to thrombin, thrombin then activates fibrinogen to fibrin. This fibrin that is initially formed is a monomer, but once again, in the presence of calcium, it rapidly forms fibrin fibers. So these fibrin fibers, when they're acted upon by the fibrin stabilizing factor, they then form the cross-linked mesh that is made majorly of fibrin, but also of platelets and blood cells and so on. So it is this mesh that we see that actually forms on the blood clot. Next week, God willing, I will have a video here on the 2 pathways. So let's have a quick recap now. Hemostasis after trauma to a blood vessel is made possible through blood clotting. And blood clotting involves a bunch of steps whose major participants are the platelets and the 12 clotting factors. The process of hemostasis usually ends with the formation of a fibrin mesh over the wound, which is composed of fibrin, obviously, platelets, blood cells, and blood plasma.